Do you know what the white coat syndrome is? If you don't, this video is for you. Are you having white coat syndrome? Heart is racing. You know this is just a routine check, but you can help feeling anxious. The doctor's office always makes you nervous. You aren't alone. Many people feel anxious in hospitals and clinics. The medical setting can be quite intimidating. You worry about bad news or uncomfortable procedures. White coat syndrome is a real phenomenon. Our brains are wired to react to perceived threats. For some, the doctor's office triggers this fight or flight response. When we feel anxious, our bodies release hormones. Adrenaline causes our heart to beat faster, and the blood pressure rises as a result. This is our body way of preparing us to deal with danger. Of course, a doctor visit isn't a real threat. However, our brains and bodies sometimes struggle to tell the difference. This is especially true if you have had negative experience with healthcare in the past. Most doctors are aware of white coat syndrome. They understand that patient might be feeling anxious. A good doctor will be patient and reassuring. They are trained to recognize the signs of anxiety. They may ask you questions about your stress levels and take your blood pressure several times to get an accurate reading. If you are feeling anxious, let your doctor know. They can offer strategies to help you relax. Open communication is a key to positive healthcare experience. There are things you can do to manage anxiety at the doctor's office. Deep breathing exercises can be helpful. Practice breathing in slowly and exhaling fully. Distraction technique can also work wonders. Listen to music or read a book while you wait. This can take your mind off the appointment. Remember, your doctor is there to help you. Don't be afraid to ask questions or express your concerns. By working together, you can make your next doctor visit a positive experience. So, the previous video was about the brief discussion about white coat syndrome. Now, what causes white coat syndrome? Why is it important to differentiate between white coat syndrome and the real hypertension? In this video, we'll talk in detail about it. So, do you know what is white coat syndrome? In simple words, it is the condition where a patient blood pressure is higher in medical setting than at home. The medical setting refers to hospital or any clinics in which blood pressure is being measured. So, in this figure, we can understand the same patient when he is at home and the same patient when he is at hospital settings. So, at home, the person is calm and relaxed, and the blood pressure measured is the actual blood pressure of this person. But however, in the hospital, the patient is feeling anxious and nervous, so his blood pressure shows a higher value than the actual blood pressure. So, this rise in blood pressure at the hospital setting is known as white coat syndrome. Now, we can better understand by this figure analysis. Two scenarios can be seen in the above picture. On the left side, when he is at home, calm and relaxed patient, normal blood pressure reading. Is it because of home? Of course it is. Home environment is promoting his relaxation. So, the same person when he is at hospital, anxious and stressed patient, elevated blood pressure readings, the medical setting is contributing to anxiety. So, higher blood pressure reading can be seen when the same person blood pressure is being measured at the hospital. This is known as white coat hypertension. So, in order to prevent misdiagnosis and mistreatment and over medication as well, is it important to understand this? Of course, it is important by both the patient and the doctors. So, why does white coat syndrome happens? Psychological response to medical environments, fear of diagnosis or medical procedures, and anxiety triggered by presence of healthcare professionals. Now, why is it important to identify white coat hypertension? Potential for overdiagnosis and over-treatment. As I have said earlier, the blood pressure due to white coat hypertension is actually higher, so it may have potential for overdiagnosis and over-treatment. Importance of accurate diagnosis to prevent over-medications and differentiating between true hypertension and white coat syndrome. Now we have read about the causes and why is it important to identify white coat syndrome. Now, how to diagnose white coat syndrome or white coat hypertension. Use of 24-hour ambulatory blood pressure monitoring, that is ABPM, ambulatory blood pressure monitoring. Comparison of home blood pressure reading with clinic reading. Importance of multiple readings over time. So, following this procedure can help to correctly diagnose the white coat hypertension and actual and the correct treatment for the patient. So, it is very important to understand about white coat syndrome by both the patient as well as doctor for the correct treatment and correct medication. So, thank you for watching. For more medical informative video, please subscribe this channel. Thank you.